you're sitting in back and you never came up, you can do it after the presentation. We also have some information up here as you're listening and you say, oh, I should have that form. We'll have them out at the end of the meeting so you're able to pick those up. Today, for the most part, we have a couple different presenters. Aflac is here, and that is Shannon Ladwig. She's going to talk to you for 5 minutes about Aflac. If you're interested after, she's going to be in the back, so you can go talk to her. Primarily, who you're going to hear from is Rayanne Modry and Pete Dewar. They're from USI. So back in June of 2023, we started meeting with Pete and Rayanne. Rayanne's been with the district on and off for about 30 years. Started meeting and saying, hey, we've got to do something different here. This isn't working for employees. We have employees who are ending up going to collections because bills aren't getting paid and they're not getting paid out the right way. We're having medication challenges. We are limited to the Frater Foley family system. What can we do? And so we had 12 meetings from June of 2023. We've had 12 meetings with them, and we've come up with a plan. So they're going to share the plan with you. They are going to be here after. They also, we also sent out information if you wanted to sign up with them individually to have conversations so you can get more information. So we're going to hand it over and get started so we can get you moving up.
All right, thank you very much for letting us be part of your benefits. I'm Shannon, and this over here is Carrie. We are going to be your new Aflac agents that are going to help take care of any questions you have regarding Aflac. Like she said, after the meeting, we will be in the back, so if you have an existing policy or you have questions on anything new, we will be back there to answer them. So in your pickup here, you probably picked up a form from Aflac, like it says interest sheet. So if you turn that in at the end of the day, we will reach out and set up a time to talk to you about the Aflac and if any of it is correct for you or right for you. So right now, just a couple things about Aflac. So Aflac is something that pays you directly. It does not pay hospitals and doctors. It is a voluntary product that helps fill the gaps in your normal health insurance. We know health insurance is designed to mainly pay for hospitals and doctors and cover those expenses, but there are out-of-pocket expenses that occur, and that's what Aflac is for. The rates are stable, which means the rates do not go up. So for those of you that have Aflac, you probably have noticed that your rates have not changed unless you made a change to your plans. So that means you add somebody or you take somebody off. The plans are also portable, so if you retire or you leave here, these plans can go with you at the same rate that you are already paying. There are 3 plans that are being offered. The very first one is the accident plan, and it's exactly what it says. It's an accident plan. It pays based on injury. So if you go to the emergency room, family physician, eye doctor, dentist, the ER, any of those type of things, that is going to start the plan in motion. So you go in for an injury, it pays based on how you're being treated. Did I cut myself? Did I break something? Did I tear something? It pays benefits based on that. So it can cover you or it can cover your entire family. So if you have children that play in sporting events and something occurs, those benefits are also going to help cover them as well to help offset that out-of-pocket expense. The second plan we have is the critical illness plan. So that pays a lump sum of dollars to you. You can choose anywhere from $5,000 all the way up to $50,000. So when you're looking over that insurance, you have to determine what type of risk do I have and what kind of out-of-pocket expense may I occur, or how will that financially affect us if somebody is diagnosed with cancer, has a heart attack or a stroke, kidney failure, or needs major organ transplant. That is going to pay a benefit amount to you directly. You take that benefit and then you do what you need to do. Is it pay medical bills or is it help offset out-of-pocket expenses? On that plan, your children are covered at no cost, and they get 50% of your benefit. So if you take a $10,000 benefit, one of your children are diagnosed with cancer, they would have a $5,000 benefit that would come to you on that critical illness plan. So again, that is a plan you would look at and consider if you have concerns about those type of illnesses. Then the last plan we have is the hospital plan. This helps offset out-of-pocket expenses occurred when you are hospitalized. So it pays for an extra benefit to you for being hospitalized, for days in the hospital that you spend, and again, this can cover you or your entire family. So again, we will be in the back, but I will
Good afternoon, everybody. We're going to make sure that we get you out of here as fast as possible, but we do have a lot of information to share with you today. So my name is Rayanne Beaudry. I am a Vice President and Practice Leader of Employee Benefits here in the Wisconsin market for USI Consulting. We're an insurance broker, basically. Off and on, as Diana said, I've been working with the district since 1994, with the exception of 3 years, the last couple of years prior to 2023, when I couldn't work with the district due to a non-compete. So I have made the journey with this district for a really, really long time. What you're going to be hearing about today is we're doing something entirely different than what you've been doing before. The district is moving to what's known as a partially self-funded plan. It allows us to be creative. It allows us to give you more of what you want, but it also allows us to purchase health care differently. There's a lot of moving parts to this. What I want you to know and understand is we have a lot of folks here today. The clinical pharmacists will be here tomorrow if you want to meet with them individually, depending upon which prescription drugs you or a family member might be on, as well as Friday morning. And we're going to introduce them to you later. I will be here and after the meeting, as will my colleagues and people from both the third-party administrator, the network, etc. We're all here to answer any further questions. I know many of you probably can't stay after the meeting today. Pete Dewar, my colleague, who I will be introducing next, will be here all day tomorrow and most of the day Friday. So we're going to make sure that we are readily available to answer any of your questions. I do want to assure you that you are not a guinea pig. Everything we're talking about has been done by school districts before, even some in the state of Wisconsin. It's a very different experience. When we're partially self-funded, the difference between that and being fully insured is the insurance company doesn't direct all of your activities anymore. We still have an insurance contract that's underlying, but we're all in this together. We get immediate credit on our claims for anything we do well together to help mitigate costs, reduce them, and stabilize them. We also get to save money and do different things with that savings, like repurpose some of those funds and do better things in our health plan in the future. And last but certainly not least, we get to recognize that the district is trying to give you the very, very best that they can with the monies that are available to run these programs. So as I said, and I think the big takeaway is this is going to be new. Some of it you may be very excited about, some not so much. But I will share with you, you are not guinea pigs. This has been done before, and I can tell you which school districts it's been done at. So enjoy the presentation. It's being recorded. You will also get a brain shark after the fact today. But we do need you to pay attention because it's a lot different than what you've had. Thank you.
All right, so I know Rand said we were going to go fast. We're trying to get through a couple of parts that are going to be the changes to make sure that everybody understands it. So my name is Pete Dewar. I will be here tomorrow to answer questions. If you have questions about doctors or hospitals or any of that stuff, I will be around. You sign up for meetings with our pharmacist. That is fantastic. I'm going to post up in the district office and hang out. If you have questions about anything, please come talk to me and we can walk through any of that stuff. So what I'm going to start with, just to talk through, we see an agenda of everything that we're getting through here today. But I'm going to talk about your key open enrollment stuff and how the plan is going to work with the deductibles, the out-of-pocket max, the basic stuff for you in the plan design. So you can see open enrollment is going to go from today through the 20th. All benefit elections are going to take place on July 1st. Your first payroll deduction will be on August 30th, and the deadline to enroll is going to be May 20th.
Will this presentation be emailed?
Yeah, I think we're going to get it on Brain Shark. It's going to come out with that, so you'll be able to flip through it. So, yeah, I would have loved to have told you, no, please memorize this right now. So open enrollment, what is open enrollment? This is our time of year whenever we get to make any changes. If you need to make a change after open enrollment, so you get to November and you're like, you know what, I'd really like to be on that plan, the only way you're going to be able to make changes or come on the plan is if you have a qualifying event. So marriage, birth of a child, death, anything like that, then you can make changes. If you don't have a qualifying event, this is the one time a year that you get to make your changes. So who is eligible? Any employees that are working 30 hours per week. Legally married spouse, domestic partners are not covered, and any children up to 26. That law was changed a couple of years ago. They do not have to be full-time students or anything. Your kids can be on these plans until the end of time, apparently. So up until the age of 26, you can have your kids on the plan, regardless if they're dependent years or have their own jobs or anything. So just a couple of definitions that we're gonna talk through. If I say something that you don't understand, please raise your hand. We can walk through it. I think everybody's pretty familiar with co-pays and deductibles and co-insurance and how this works. That's what we're gonna get through in the first part here. Is what your deductible is, what you would pay as your benefits are being kicked in, and then what your absolute out-of-pocket max is. If you have the worst year ever, what your all-in number will be. So here's where we made some of our first changes. So today, the plan that you have with Prevea 360 is a $7,000 single deductible, a $14,000 family deductible, with a reimbursement, a 50/50 reimbursement that starts to kick in right away, paying 50 cents of every dollar that you spend, okay? As Diane alluded to, we had a lot of issues with that this year, with the HRA not paying correctly, with Holy Family sending people to collections. It was a big mess for a very long time. So what we've done is we got rid of the reimbursement program. We just lowered the deductible down to the IRS limits to be a qualified high deductible health plan with an HSA, and I'll talk about an HSA in just a minute. Your single deductible is going to be $3,600, with the family deductible of $7,200. I want to talk about that next line up there where it says it's an embedded deductible. What embedded means is that if you have more than one person on the plan with you, one person cannot go over the single deductible. Okay? So I've got a family plan. I'm married, 2 kids. We're all on my insurance. My daughter has decided to bust her shoulder in volleyball and then break her wrist snowboarding in like 4 days. She's the only one incurring claims in our family. So she stops at $3,600. She cannot get to $7,200 by herself. We need a combination of family members to get to $72,000, all right? So that is your single deductible. After that, the co-insurance is 100%. Okay? I know the out-of-pocket max says $7,000 and $14,000. The only way that you will get from 36 and 72 to those numbers, it was some minor co-pays on drugs. And the co-pays have a minimum of $10 and a maximum of $50, so you would need a lot of prescriptions to get to those numbers. Okay? So your main numbers up here are $3,600 and $7,200 for single and family. So just the plan highlights, keep in mind, everything that's coded is preventative, the same as it is now on Prevea 360, it'll be the same in the future. When you go to the doctor and you have something coded as preventative, it's covered at 100%, all right? So when you're in there for well checks, for annual visits, lab work once a year, you can see the list up here and you'll get a copy of this, but when your doctor codes something as preventative, it's covered at 100%. It does not go towards your deductible or anything, it is just paid for. So that is not changing. Drugs, and we are gonna get deep into drugs here in a little bit when Sergey comes up to present. But you can see our generic drugs are going to be covered at 100% after the deductible. So if you hit your deductible and you have a $4 drug, you're not gonna have to pay for that. Same thing with preferred brand name. The minimums that I talked about on the non-preferred brand name, 10% after the deductible with a minimum of $10 and a maximum of $50. We will get into the weeds on that here in just a few minutes. But that is what the drug plan is gonna look like. The preferred specialty, if there's one thing that you take away from this today, it's when Sergey comes up here to talk about their model, their PBM, and how that specialty is going to be covered. Okay, we are not just completely cutting out specialty drugs, but we do have a budget to manage, and we found a good way to do that with a great partner. So an HSA. So because we got rid of, your plan the way it is today, you have a high deductible health plan, but you cannot take advantage of a health savings account of putting away money pre-tax into account that you can use for medical, dental, and vision expenses because you have an HRA that kicks in immediately. So per IRS rules, if you have first dollar healthcare coverage, you cannot put away money pre-tax. So on 7/1, we are going to change that. You will have a qualified high deductible health plan. You will be able to put money away into an account that we were just having the conversation, we are going to work with Associated Bank because they do not charge fees to public school districts. So you'll be able to put money away pre-tax into an account that you can use for medical, dental, and vision expenses. Okay? Great thing about an HSA is it is your money. So if you were to put $10 a paycheck in for the year, and you have $260 at the end of the year, and you didn't have any healthcare costs, that money's yours. That rolls over. You can keep that money forever, right? I've had an HSA for 15 years. My kids were little and healthy, it was great, and then they got 90 sets of braces, and I spent all my HSA money. That is what you can spend your money on. My wife got LASIK surgery with HSA money. You can save that up and spend it. It is your money. You can save it up until you're 65 and pay your Medicare premiums with it. All right, it rolls over every year. You can change you drive line and sane and change your deductions every week if you want to, how much you put in there, but that is your money. We feel like this is a much better model than having an FSA and a high deductible with no HSA advantage. The IRS puts limits on how much money that you can put into an HSA every year. For 2024, if you have single coverage and it's just you on your plan, you don't have any dependents, you can max it out at $4,150. If you have a family coverage, you can max out at $8,300. And you can see on the bottom, the school district is going to give you some money. Okay, they're going to put $700 in for a single, $1,500 for a family. It is not going to be in just one lump sum. We are going to figure out if it's quarterly or twice a year, how that's going to go. But they are going to seed you money into your HSA to get started. Okay? Those limits from the IRS, those include your employer contribution. So the IRS wants you to keep track of what that is. So if you want to max out, if you've got single coverage and you want to max out your HSA contributions in 2024, you have to subtract $700 from $4,150. And I'm in sales, not in math, so I'm not going to say $3,450. That's allowed to be wrong, but that is you need to manage that. All right, so that's as much as you can put into your HSA in 2024. I talked about some of the advantages of these. Again, it is your money. So if you had money in an HSA and you left Two Rivers School District to go to another school district, it's still your money, it's still your account, you take it with you. It is portable, okay? So this is what your rates are going to look like. So from making these changes, from going through this whole thing, and I'm gonna bring up Paul from HBS here in 1 second. He's gonna deliver what I think is probably the best move, the news, and I'm probably gonna steal it from him right now. But at the moment with Prevea 360, you guys have a base plan and a buy plan. And that base plan, you can only go to things that say Prevea on it, right? You have no out-of-network coverage. If you're on the buy plan and you're paying money for that plan, you can only go to Prevea in-network, but you have out-of-network benefits. We have changed that. I showed you the benefits. There's only one plan, and it is a broad network. You can go to Aurora, Prevea, Bellin, Ascension, DataCare. You can go anywhere you want to for the most part. Every major system in Northeast Wisconsin is in. So we've done away with the narrow Prevea network. We'll hold the applause at the end. I thought so. That's right. This is what the rates are going to be. Okay. It does cost money to go from a super narrow network to a broad network. We feel like we've brought a better solution here that gets us out of the Holy Family mess, gets us out of the collections mess, and opens up our network to go to any doctors we want. So how much are you really paying? So we put together a chart here with the district to kind of show what it would look like of your premiums that are going in, and then we use your worst case scenario, right? So if you did hit the deductible, if you had the worst year ever, and I hit the deductible on the family plan, $7,200. The district did give me $1,500 into my HSA. The cost of my cost sharing at 6.5% shows what I'm actually paying out at $7,233. Your current deductible with Prevea 360 was $7,000. So we're getting all the doctors back without that much of a change. And again, you will get a copy of this. And again, we did that as worst case scenario. Okay? So if you're not hitting the deductible or you have a healthy year, you don't have much healthcare costs, your numbers are a lot lower.
One other item to note is these payroll deductions are lower than they were in 2019. So if you look back at what, if you've been here that long, at what you were paying for a broad-based network, these are actually lower on both a single and a family basis.
So we've come back around to be able to offer a broad network with all the doctors in it and less money than we were 5 years ago.
I know this doesn't apply to everybody, but it does apply to some. I'm retired, and I know there are other people in here who are retired. Will we get a separate sheet telling how much we're gonna have to pay in total? So you're saying how much is gonna be taken out of each paycheck?
Yep.
I don't get a paycheck anymore.
Right.
And
Yep.
aides get different too. We get a different amount taken out than everybody else.
So I believe from NIS, from the retirement, that will be, we can walk through that, again, I'll be here after that, or we can go through it, but agreed. You know, if you're not getting a paycheck, you don't see the regular deduction.
Okay, we will work on it separately.
Okay, sounds good.
So maximizing your benefits, just a quick slide on this, just again, I talk about a broad network, I talk about all the major hospital systems being in it. You still want to double check and make sure that you have the doctors in it. Paul's going to talk about that in 1 second. I came in here last year and I talked about GoodRx. I talked about being a consumer for your prescriptions. I still recommend that. I still recommend going online and seeing where you can find prescriptions. I used GoodRx yesterday. My daughter had a prescription for $199 that I got for $39 using GoodRx. So there's still consumer tools out there to use, but we feel like we've opened up this whole thing for you guys so we can get away from the narrow network of Prevea and go to wherever we want to. Cool. I'm gonna bring up Paul from HBS.
All right. Hi, everyone. Paul from HBS, Paul Miller. Go through the network solution that we're bringing to the table. We also have what we call a Super EOB powered by Paymedics. So the way you pay your bills will be a little bit different with HBS, but I'll go through the network stuff first. Then get to that. So as Pete said, we have a broad-based network. So these are the providers that are in our network. I'm from Milwaukee, the former headquarters, so we're a Wisconsin-based PPO network. As you can see there, the eastern part of Wisconsin, we have all the major providers in network here. Holy Family, Aurora, DataCare, Prevea, all those in this area are in network. Door County Memorial. So anything really in this area is going to be in network. We do contract by system. So if you go to an Aurora doctor, they will be in network with us. Now, obviously you might want to double check. I'll go through the provider finder in a little bit. But what we do, even though we're broad-based, we do like to identify providers that we consider high value to make sure that you're going to high-quality providers that are charging a fair price. So you can call into this number here. It is separate from our customer service number. Again, this PowerPoint will be available so you can get this. But it is a number that you can call in if you're having one of these services or some others. You can check to see if there's a high-value provider, you know, within a half hour, 45-minute drive or so. So I don't think we have any in Two Rivers proper, but if you're getting one of these types of things, an elective surgery, knee replacement, Achilles, things like that, shoulder, things like that, some high dollar items. Give us a call to see if there's a high value provider that give us a really good rate at this stuff. So just a quick analogy, you know, if you're going to a restaurant, obviously the restaurant's making money off food, but they really make money off drinks and alcohol, right? So think of these things as like hospitals. If you go to Aurora, these are high priced bottles of wine that you know are way cheaper if you just buy them in the store. We've found those providers that are charging retail for this stuff, so you don't pay the high prices. And that helps the whole plan as well. And again, these are high quality providers, low infection rates. They're just not being done in the hospital setting. So they're done more of an outpatient and it will cost you and the plan less. So again, this phone number will be available on the deck. Whenever you call in and see if there's a high value provider that you're willing to go to instead of staying within like an Aurora or a daycare in the hospital system. So Paymedics, Super EOB, we do things a little bit differently with our billing. Pete just mentioned at the end there to check your provider and check the EOB. And I know for me when I get bills from the hospital, sometimes I wait to see if there's red letters on them, and then like, oh wait, I gotta pay this now. I open it up and I pay it. We're kind of trained like to get 3 or 4 pieces of mail before you actually do anything with it. So actually, why we were founded as a company was this Paymedics idea that our founder had back in 2005 of creating a billing system that basically puts it in like a credit card-like statement. So you get a monthly statement for us that is both a bill and EOB combined. So the front of it will have the charges, the summary of what you owe for that month, and the subsequent pages will have all that normal EOB information, which person was a subscriber, dependent, which person saw provider for what, and then you can see what those charges were for, and then it all totals up, and then you just pay us. And we actually go to the providers on your behalf, and we pay them the money. So you only pay us, and then we go to the providers and pay for you. So this is a family-based statement that'll come monthly from HPS, and then, like I said, you just pay us directly, and then we distribute the funds for you. So it simplifies the billing process for you. Again, it's all one statement. You don't have to wait for those red letter envelopes to show up, and you're like, oh wait, I gotta do something. You just get it, you just pay us, and then we take care of everything from there. If you want someone to be on their own account, if you have an adult dependent that like, hey, they should be paying their own bills, you can separate them out. Just give us a call. We can set them up on their own account. Online access, there's really 2 main functions, as you can predict what I just talked about that you can do on our provider portal. One is looking up providers. That you do not need to log in. Again, we contract by system, so if you go to an Aurora doctor, they will be in network. But if you want to double check, you can go out here and do the provider search. If you don't see them out there, you can call into customer service. They have a secondary system they can look up in, and if it's not there, they'll actually get with our team. We'll reach out to, say, Aurora or DataCare, whoever, and confirm, and then we can get back with you. Sometimes these rosters get updated regularly, so sometimes they're not in our system, so don't be alarmed. Call us and we'll confirm for you if need be. So that's one thing you can do, and then also you can make payments through the provider portal or through our online member portal as well. So if you want to make a one-time payment, you can do that. If you want to set up a payment plan or pay with credit card, you can do that through the online portal as well. So I mentioned payment plans. Again, so why we were founded was to simplify the billing process. Part of that is we offer all of our members interest-free payment plans. So if you can't pay at the time, at the time of service, well, I want to actually mention that. So at the time of service, you will not pay anything. There's actually going to be something on your ID card that says no payments due at time of service. So you don't pay copay, you don't pay anything. The provider knows that they're getting the payment from us, and that you're going to pay us back on the back end. So then when you want to pay us, you can go online, you can do a paper check, you can call in and just give us a credit card number, whatever is easiest. Again, if you can't pay right now, just give us a call. You can get on an interest-free payment plan. If something like that's not going to work for you, you need your account on hold, something like that. We have hardship programs where we can temporarily put you on hold until you have some money. We're here to work with you. Again, this is why we were founded as a company. We wanted to help people pay their medical bills. So, question here?
Yeah, if you pay in full, do you get a discount?
So the question was, if you pay in full, do you get a discount? Unfortunately not. That would be something. We actually are considering doing something like that. So I will take that feedback back to our team. We have regular product meetings that we've considered doing that. I will let you know if that happens. We are thinking about doing something like that. So if you see a negative balance on your bill, that is a credit. So that means something was reprocessed and there's a credit on your bill. So you don't owe anything if you see that negative balance. If you go 2 months without having additional claims, we will issue you a check back. So you don't have to do anything. We'll write you a check for that, but we hold it there for 2 months in case there's other claims, and then that credit just comes off the subsequent claim. So again, so if you can't pay us, please give us a call. I heard earlier, obviously, the experience with people being sent to collections, things like that. But we don't want to do that. We want to work with you. We have hardship programs. Please just give us a call. We'll work with you on a payment plan that works for you.
So if it's through this, does that mean that we won't be receiving a bill anymore from the actual provider?
Correct. Yeah, the question was, will you get a bill from the provider anymore? You should not. And if you do, please let us know, and we'll reach out to that provider and say, hey, this is an HPS member doing this. So, yeah, so let us know.
So you also work with the HSA that we can use the HSA to pay the bill?
Yes, you can use your HSA money that you put away and that the district gives you. You can pay us with that as well. So customer care, I've kind of talked about what you can do with that this whole time. But there it is again, in case you forgot. One thing I'll point out here is we do need to know if you have secondary insurance, because if something's supposed to be pick up, what we're billing you, we need to know that. So if you have secondary insurance, please call us and let us know if you have you and the spouse's insurance at the same time. Let us know that. But yeah, other than that, normal customer service stuff here. Call us with any questions that you might have. Really around the providers and so obviously having options and a broad network is very important to the district, and having you guys have options here. So we actually going to stack our network with Trilogy. That's another network. That's not HBS, but this is another network. So we're kind of eastern Wisconsin. They go further west. So if you have students, things like that, if they're in network with Trilogy, that would go through a normal EOB process, that you're used to, where the bill, you get a normal bill, and then PBA will send you an EOB. But so our contracts would be first. So if they're with HBS, like they have Aurora, and we have Aurora, our contract would apply. They'd be on the Super EOB. But if you go to Marshfield or something, that would go through Trilogy. So they go further west. And so you have full state coverage through them, and that's their provider finder as well. So any questions on any of this?
So if you're on vacation in a place that's not a dot, is there any coverage at all, or do I need to drive for 3 hours to where there's coverage or something? What does that work like?
So we have some coverage in here too, so we don't have the maps overlaid. There
No,
really
but I
should.
noticed there was a gap in some areas of the state. So what do you do then? Where we go, I think it's Spearus or something.
So
What
yeah,
would that use it?
Trilogy is actually talking to them right now. They don't have them in network now, but they're talking to them.
So that would be-
Agreement, so that'd be out of network. Emergency stuff
Yeah.
would be,
We do have a nationwide wrap through a company called First Health, so where the gaps will be filled in. You don't need to necessarily worry about that, but I am aware. And, for example, my original hometown is Park Falls, Wisconsin. They have the clinic in Woodruff. They are affiliated with Marshfield. So it usually goes to where the main system is to where those offshoot, clinics and physicians are. So up in the western area, for example, there's a lot of Mayo clinics. They're connected with Mayo, even if the dots aren't there. So, you should have very little trouble in Wisconsin.
What about
Or
other?
nationwide, right?
Okay, so
that's
nationwide.
the
is
first
still
health, the first health that you talked about,
Okay.
that's out of Wisconsin, yep. And over to Veronica.
Good afternoon, everybody. Veronica from Professional Benefit Administrators. If you never remember our name, that is okay. There's a lot of acronyms being thrown at you and a lot of company names that are being thrown out. So just know that we are the third-party administrator of the benefit plan for Two Rivers School District. What our job is to take care of those claims and the processing so that the staff here, like Lana, Mary Kay, and Diane, don't have to do the work. So what we do is we're going to support the school district on the benefit plans. We're going to administer the plan based on the plan benefits that are being offered to you by the district. And we are here to support you from a member advocacy support. So if you remember those two things is we're here to support you and we're here to do the job of the insurance piece for the district. So what's new? Everybody has covered what's new today. What I want you to take away from this is effective July 1st of 2024, that's when the new plan hits, that's when PBA comes into the picture. We are going to be starting to process those claims under the new benefit plan. You can call us for member support. We can answer questions for you. The number one thing that I want you to remember is when you get the new ID card, which will come closer to that July timeframe, we'll communicate that with the district as we implement the plan and set up the plan benefits for the district with us. Remember, when you go to the doctor for the first time, January 1st and on, please remember to give them the new ID card. Because if you don't give them the new ID card, guess what's going to happen? They're going to send their bill to the previous insurance company. And then you're going to get a bill saying you don't have insurance. That's not the case. So just keep in mind, anything prior to 7/1, old plan. Take care of that the way you're taking care of that today. 7/1, new plan. So just be very cognizant, and we'll communicate this as we set up the plan. When those ID cards come, you're gonna get those ID cards to you, put them in your purse, put them in your wallet, and make sure that when you visit your doctors or go online and update that information. If you walk into the doctor on 7/2 and they say, you don't have insurance, just ask the simple question and say, I gave you my new ID card, are you processing it under the new ID card? Because it's happened to me, even though I'm on the same insurance for 2 years, guess what? Someone in an office is billing the wrong insurance because they never removed the old record, okay? So that's what's very important from this. So we're gonna be here to answer questions for you on your benefits. So member contact information, I keep saying January 1st, because a lot of plans start on January 1st, but July 1st, if you have any questions, this is the number. Your ID card is gonna have our number on it. If you have any questions on a claim, if you have any question on where can I find my ID card, if you need another ID card than the 2 that we're gonna be sending you, just call PBA. We're here to help you with the benefits. Our member advocates will have the plan information that the district is rolling out to you and your family answer a lot of questions at PBA. So our office hours are Monday through Friday, 7 a.m. We just extended our hours to 6 p.m. Effective July 1st, you will have access to a website portal where you can find claims for your new plan. A lot of different information, like a copy of the ID card, so if you can't find it, you can log in. So I encourage you, after July 1st, to go on pbaclaims.com, set up an account with us. You're going to be able to link or find the link to the HPS Doctor Provider Facility Network. I know that we've given you that information, Paul just went through that. On our website, you will have that link to the HPS Provider Network, which is very, very helpful. So if you're looking for a provider that's in network with HPS and Trilogy, you can link on there and go straight to their website to find a provider. Okay. Questions so far? We are available through customer service, so when you log in and you set up your account, a really easy way to send us a secure email address is log onto your account and you can submit secure messages to PBA. I encourage you to do it through your account, especially with all the fraud that's going on out there. Okay, so find the network. Paul went through that and the information to call them if you're having trouble finding a network. But again, all of that information will be also posted on our website. What's the most important thing July 1st? ID cards, okay? Because that has really all of the information your doctor needs to submit that claim properly through the right channels. Setting up your account, just went through that. You'll get some information. We have provided this information to the school district and to USI. So that will be coming out. And you won't be effective on this portal on our website until, let me say January 1st, July 1st. Okay? And it's just because we're not done with enrollment and setup. Okay? This website is mobile friendly, iPad friendly. You don't need to download any additional app or anything like that. All you need to do once it's set up is just log into your account, and it's device friendly on any device that you're utilizing. Okay. We're here to help. We're very excited to have you guys with us. And if you have any questions, our member advocates are here to help you guys, okay? If you have any questions prior to that, please facilitate those through the district, which will come to USI, and we can help. One thing that I do want to put out there now, if you have any surgeries that are going to come into play after July 1st, let the district know. Those will be funneled, and we can make sure that that coordination that's already done gets handled if you have a surgery after July 1st. Okay, we can help with that too, and make sure that there's a seamless transition there. Questions for me?
Does this include just healthcare, or is this dental and eye also?
We are just administering healthcare.
So that's our eye?
We'll get to that part, because that'll be.
Any other questions? Otherwise, I'll let the
Why, so, I'm confused, why are we contacting you versus him, like, what's the division of labor there? Yeah, I don't remember, I'm sorry, he has a very nice name, I'm sure. But-
Paul, the one right before me, so HPS. So we are the administrator. We're going to administer your plan according to your benefits. HPS is the PPO network. They're the ones that facilitate and have the contracts with the physicians and the hospitals.
Okay.
The time that you contact him, and I will say this, when in doubt, call us. When you contact HPS, it's for that payment. You know how he said that they pay the providers on your behalf? You will get what he is referring to a super EOB. It's an explanation of benefits. That explanation of benefits for your portion that you are responsible for, they're paying that up front, you pay them back. If you have any questions on that super EOB or the payment, that's really when you call HPS. Does that make sense?
He's the money guy, you're everything else.
Pretty much, yeah. If that's helpful. Or to find a provider, you know, because they're the ones that hold the contracts with physicians and hospitals. So if you can't find someone on the website, on the HPS, they can help you find a provider very quickly. But when in doubt, you can call us first. We're very used to getting the calls for HPS. They're not the only client that we have with their network. And when necessarily, we'll transfer that or do a three-way call with HPS so we can facilitate those. Okay? Questions? All right, thank you.
Good afternoon. My name is Becky McAvoy. I'm here to discuss the pharmacy benefit portion of your open enrollment and the anticipated changes. Joining me, I have two pharmacists, Renee Wallace and Jeff Bowie. They are here to meet with anyone individually to discuss personal matters specific to the drugs they themselves or a member of their family are taking. We want to make sure you are comfortable with this transition and that you know exactly what to expect. And we'll go into what the changes are, but we highly encourage you to take advantage of their time while they are here on site tomorrow as well as on Friday morning. If those times do not work for you, it is okay. We have plenty of time before July the 1st, and we can find ways to meet with you and discuss your personal questions. So ServURX, we're managing your pharmacy benefits. We are going to discuss the three primary changes that you will likely encounter and how to best navigate them today. Before I jump into that, I want to echo what Veronica said. We all work collectively as a team. The folks at USI, your contacts at PBA, HBS, and ServURX have numerous mutual clients. We work as a team. So don't worry about who do I go to. If you go to one of us, we will get you to the right contact. But I will say, when in doubt, go to PBA. So, ServURX is the nation's longest-standing privately held pharmacy benefit manager. We are located in Milwaukee, Wisconsin. We are a Wisconsin company, and we are committed to helping you make the most of your benefit and become wise benefit consumers. We do this by providing you tools and programs to reach those goals, as well as to help the district reach their goals. The first thing we're going to talk about is a formulary. That's a covered drug list. Those are the drugs that are covered under your program and their tiers. You're used to hearing things like generic. That's one of those covered drugs that even once you meet your deductible is covered at $0. There's then tier 2 or preferred brands. Those are the brands with the highest efficacy. Those are also the lowest cost compared to their counterparts with that lack of efficacy. And then there are specialty drugs. There is going to be a little bit of a change to how you acquire specialty medications going forward. So if you take a specialty medication in particular, I highly recommend, not just you, a member of your household, I highly recommend interacting with the pharmacists. And then customer service. Outside of myself and the team of pharmacists, we do have a customer service number that you can reach 364 days a year. The only day we are not open is Christmas. So the select formulary places greater emphasis on preferred drug utilization, generics, and it excludes those that do not have any additional clinical value for their higher cost. The preferred drug list is available on our website. It is something that is very easily accessible. And when I mention the word exclude, out of the universe of medications, less than 80 are not covered. And they really are egregiously high cost with lack of clinical value. For any medication that is not covered on the drug list, there's a minimum of 2, sometimes 5 alternatives. And if you have any drug-specific questions, our pharmacists are here. So as I mentioned, specialty drugs are going to be covered in a new and different way. The program is referred to as Specialty Assist. If you are taking a specialty medication, we will reach out to you when we see the claim attempt to be processed. Any specialty drug requires prior authorization, and that's because they're very high cost and they're used to treat very specific disease states. When we engage with you, we will tell you what is necessary to get coverage on this medication. Typically, it is coordination between us and your physician to fill out appropriate paperwork, and you will also need to share household income information. The reason that is necessary is we are working to have the manufacturer or patient assistance programs cover the cost of your specialty medication. Currently, you are paying towards your specialty medication. With this program, the coordinated efforts of your physician and the folks that serve URX, you will be paying $0 for this medication, and you will be helping this plan save immensely as well. We are taking advantage of programs that are available out there to keep these costs down, and it just requires a little upfront interaction. That upfront interaction is not going to in any way interfere with your therapy. If you are on a specialty medication right now, you will still be able to fill it once it is approved. And even while we're working through the manufacturer and patient assistance program, we can have the medication covered. So please do not worry about an interruption of your drug therapy. Just know you will need to be engaged to get it covered for the next year. And if you're unsure what a specialty drug is, the slide details that. There's high-cost prescriptions that treat very specific disease states. And all specialty drugs are included in the program. If you don't qualify for manufacturer or patient assistance, we will work with you to get access to your specialty medication. And that is where RX Valet comes in. RX Valet is another service we offer. If your specialty medication is unlikely, but perhaps not covered under the patient or manufacturer assistance, it can be obtained through RX Valet. Because we've already done all of the coordination with you, we know exactly what medication you need and where you need it shipped. We'll just simply work with the partners at RX Valet. You'll receive a phone call from them to confirm shipment, where you want this high-cost medication sent, and you will continue to not have a cost share. So the benefit of the little extra interaction is significantly reduced costs for you, the members of your household, and the district. Outside of using RX Valet as an option for specialty medications that are not approved under manufacturer or patient assistance, it is an option to fill high-cost brand medications. While you're in your deductible phase, you will realize exactly what a 30-day supply of an expensive brand medication costs. If you're looking to avoid that cost, you can work with RX Valet. to have this prescription sent directly to your home. And again, you will have, at that point, no cost share. The only time you will pay for a prescription under this plan is if you are using a retail pharmacy in deductible phase or using a retail pharmacy for a non-preferred brand. If you use RxValet or you are approved under patient and manufacturer assistance, your cost is $0. And I know some of this is confusing. That is exactly why we have the doctors of pharmacy here to assist. And if questions come up later down the road, you have access to a patient portal that will give you options to price medications in advance, see if they are covered, see if they require prior authorization, to see what prescriptions you filled over the year because you're trying to make decisions for what to allocate into your HSA for the upcoming year. All of that is available through our device-friendly website. There is also our call center that I mentioned is open 364 days a year. 800-759-3203. You will have access to not just members of the call center staff, but a pharmacist who is on call 24 hours a day, 7 days a week. You might have to wait an hour for a call back, but you will have access to a pharmacist. Further, they will guide you through any of the questions you have, along with the other trusted advisors that are here with us today, your USI team and us, after today's presentation, as well as in those meetings that are scheduled for tomorrow. Are there any questions in general on pharmacy coverage? Or, yes?
Are all prescriptions going to be filled through this, or only specialty ones that are super expensive, or like maintenance drugs where you would have?
So your maintenance medications, any prescription will go through the ServURx coverage. Just like Veronica mentioned with PBA, the most important thing you can do July 1st and after when you get a prescription is present that new ID card, because we are your coverage for all prescriptions. There's not going to be a drastic change to anything other than specialty or high-cost drugs, so I didn't get into the details.
So the district sent an email last week with the listing of specialty medications. If you looked on that and you are taking one of those medications, you might think it's a maintenance drug, like some of your things for rheumatoid arthritis, for example. You're taking those on a regular basis, once a week, once a day, however that works. Those are gonna be on that list. Pretty much the high-cost injectables, anything you see on TV, you're probably gonna find them on that list. Without going past specialty RX, you are not gonna have coverage for those medications. You're paying full cost. Pay attention to that list. Get an appointment so that we can get you started so there's no disruption in care on 7/1. You have your pathway is completely all laid out. So we're all in this together. This is a little work on your part, but we want to make sure that we've got that taken care of. And just so you're aware, Medicare does this today, Medicaid does this today, the state of Wisconsin does it for their drug program, and so does the state of Florida. So we are not doing anything that's different from a lot of large government health plans. So this list was important. If you lost it, you misplaced it, you didn't think it applied to you, there are other ones at the front of the room, or we'll resend the email, but that's hugely important.
I think the email was resent to you on Monday, so you should have it in your inbox.
Any other pharmacy questions? Sure.
One additional thing, besides the special medications, is that the select formulary is a closed formulary. So any medications you are currently on branded may not be on that formulary. However, we can go through the prior authorization process to get that non-formulary drug covered as long as you try and other things on the formulary. So just note that if it's not on the formulary, since it's excluded, doesn't mean that you're out of luck. You guys can still have access to it as well as go through the pre-authorization process.
Thank you very much. If there are other questions, we'll be available.
We are truly almost done, if you guys can give it like 5 minutes. We're very close. Hi everyone, I am Ann from Network Health, and I work with the Family Savings Plan. I just have a few minutes, just to go over a few reminders. It is gonna be offered again this year, and I'm just gonna go over a few of the guidelines here. So basically, if you're currently on the district's medical plan and you have alternative coverage offered, that could be a spouse, it could be a second job possibly, or if you're under 26 and you can be on a parent plan. Those are options where the Family Savings Plan might come into play. So basically what it does is it reimburses for services for medical and pharmacy that would apply towards a deductible, a co-insurance, or a copay. Basically, there is no premium to be on this plan. If you are on the medical plan here and transition off to one of those alternatives, we don't charge a premium for you to enroll in this plan. And if for some reason, if you make that transition and that spouse's plan or that alternative plan costs more, you are gonna get the difference in the premium up to $500 a month. So it shouldn't cost you any more to transition off because you're gonna get that premium differential besides getting the medical and pharmacy reimbursed. If you have any questions, I will be here after. Otherwise, my contact information is gonna be on the slide. And one more time, just to determine if you're eligible, you need to currently be on the district's plan right now and have an alternative plan that you're transitioning off to in July, and then that would make you eligible for the Family Savings Plan. Once again, here's just the contact information if you have any questions. Otherwise, I will be here after the meeting.
I promise just a couple more slides to get through, and then we'll get you guys out of here. So, spending accounts for the last couple of years, we've had a dependent, or we've had an FSA, the flex spending account, which you put money into pre-tax. That's always been a use it or lose it account. That's how those accounts work. We've replaced that with the HSA, and when you have a full HSA, you cannot put money into a full FSA. You can't double dip. The IRS doesn't let you do that. So we are going to continue to offer the dependent care FSA, but that is it. Right? So you can still take that money you're putting in FSA, put it into an HSA, it's a better deal, it's your money, it rolls over. If you still need it for dependent care, this is still available, the IRS still allows you to do this. Our dental is staying the same, our dental and vision are staying exactly the same. They're both staying with Delta, benefits are staying the same. You can see the deductible is $0, the annual max is $1,500, and then it's a traditional $185, 100% for preventative, 80% for basic, 50% for major services, with a $1,500 benefit, lifetime benefit towards orthodontia. So same as they are this year, those are not changing for 7-1 at all. We're keeping the same carriers, same benefits. Vision is the same thing with Delta. See the vision contributions also staying the same. We're locked into that until 2026, so those are not changing at all. Last couple things here, the long-term disability is also staying the same with NIS. No changes to this benefit at all. The big benefit, the big changes came to the medical stuff. So, we are keeping Healthiest You, so that is still available. That is not changing for 7-1 as well. You've had access to that. You know when to set it up. The 4 easy steps to get through there. We have information on that. Telemedicine still have availability to do virtual visits with a broader network now, but we're still going to continue to offer the telemedicine. So before I get into the enrollment process and the enrollment forms you have, just to wrap this up, just because I know it's confusing, I've been doing this for 21 years. We're trying to find a better way to manage the plan, give you more access to doctors, but we still have a budget to balance. We still have to look at the bottom line. Today, you're with Prevea 360. Prevea 360 provides the customer service, they adjudicate the claims, they provide the whole framework for it. We've replaced that with PVA. So Veronica and PVA are gonna take that part of it. Purveyor 360 also provides the network, the doctors, the very narrow network of doctors that we can go to is provided by Purveyor 360. We've kicked them out and we've replaced them with HBS. They are going to manage the doctors. They provided a big broad network. With the network, so if you're on vacation in Arizona or Florida, you're on spring break or something, you have the First Health rep. You have doctors nationwide. That is a massive network across the entire country. You have access to doctors. If you are up north on vacation, you got a cabin or a cottage. My wife is from Florence County. There's not a hospital there. There's not a stoplight in that county, right? If I go there for an emergency, if one of the kids has an emergency, I can go to a doctor in a true emergency. They're covered at 100%. Your network doesn't matter, right? What you don't want to do when you're sitting up north at the cabin is be like, you know what? I want to get checked out today. I want to go see a doctor, right? Save that for when you get home to go into your network, all right? But if you have an emergency, those are going to be covered, all right? I just wanted to explain what we replaced there. Today, Purveyor 360 provides our drugs. They are our PBM. We're replacing them with Servier, right? It's a better deal. We'll save you money. We'll save the district money. So with all those things that I just talked about from Purveyor 360, the limited network they provide, the limited customer service they provide, the limited PBM they provide, you know what they still did to us for 7-1? They still gave us a massive increase, all right? So we're going a different way to try and manage this better and to provide you with more doctors and more choices. Ray, you just gave me like 4 things to talk about, and I just hammered on Purveyor 360. Did I miss anything? I think I got all. So our enrollment process, we talked about open enrollment opens up today on May 8th. It goes until May 20th. We need that form from you filled out for PBA with your dependents, the social security numbers, the whole thing. We do have to enter those in the system. We also want them on file for the district for anything that we need. We do have time. This is all taking effect on 7/1. We want to make sure that you meet with pharmacists or sit down with anybody that you want to talk to go through. I know the specialty drug piece is confusing. If you are on if you're on a specialty drug, you know you're on a specialty drug. You do not get prescribed a specialty drug and then walk down to Walgreens and fill it. It's a whole bigger process than that. If you're on a drug where you see it at night on a commercial where a bunch of people are dancing in the park all happy, that's a specialty drug. That costs 20 grand a month. Right? Those are the things that we're talking about. But we do need those forms from you. We will not be able to accept any changes after May 20th. We want to get that in the system. We want to make sure that everybody has their ID cards before July 1st. Mid-year plan changes, we talked about this. You can only make changes in the middle of the year if you have a qualifying event. One last thing, just from USI, just from our agency, from our company, you still have access to a benefit resource center. We talked about this last year. If you do have questions, if you want to appeal a claim, you can always call PBA, you can call me. If you're looking for another resource, we offer the Benefit Resource Center. This is a team of people. They're licensed agents. They know your benefits. They're all loaded into our system. They know about PBA. They know about HBS. They know about the Servier deal. They know what your network is. You can call and talk to them. Nice thing about their team, they are not a call center. If you call them and you open up an inquiry about something, every time that you talk to them about something, you'll talk to the same person. Okay? They will walk you through from the beginning of an inquiry until it is resolved. That is it.
Just one other quick thing, we want to reiterate one more time, we are keeping Healthiest You. So the teledoc thing is, which a lot of people really like, I'm hearing, so that stays in place. And then anything incurred through midnight of 6:30 this year is still belongs to Purveyor. So you still go through the same process you're going through today. Claims incurred 12:01 a.m. on 7/1, forward, go to PBA. So don't forget your new cards, they will come in clean envelopes.
Yes.
They're not marked, so we will try to let you know, let the district know when they're being shipped, so that you look for them, because otherwise they look like junk mail.
Yeah, due to privacy laws, they cannot stamp on the envelope anymore. Hey, your ID cards are in this envelope. And they will be the plain whitest, junkiest envelope you've ever seen. Yes.
Are you gonna send an email about the account portion? So there's stuff like timely, special, and then the division number, or
So yeah, we'll put that in an email to send out to everybody because you don't really need to do anything with that. Everybody's going to be considered a new enrollment for this. That's a great question. So I'm filling out that form on top. There's no division numbers or anything. We are all new enrollments for that. But we will send out a clarifying email on filling out that form. Yes, so on that PBA form as well, there is a waiver section. If you are not taking the coverage, if you're filling out a waiver, we do need you to fill that out.
What about enrollment?
So we will take care of that with Associated Bank. We will make sure that everybody has those open by 7/1. So the question about an HSA, we will make sure that we have all the information from Associated Bank, that we will get that all up and running. But in going to an HSA, if this is new for some people, if you're not familiar with an HSA, you will get a debit card from them. And that is how you pay for things, or if you're calling HBS or making an payment with HBS, you would do that online. I do want to talk about Paul's portion with HBS. That is a good deal. That is like having a no-interest loan for your medical payment. So if you're setting up a payment plan with Aurora, they're going to charge you money, right? If you're setting it up with Holy Family, they're going to charge you interest. HBS is not. They're going to set up an interest-free payment plan, which you can pay with the debit card for your HSA. It'll run until June 30th, right? I'll find out. There may be a 9-day run-out period with an FSA. We will find out for you. Like I said, we will all stick around if you have more questions, if you have specific stuff. I will be here tomorrow. Pharmacists will be here tomorrow. There are still sign-up sheets up front if you want to sign up for a time to meet with the pharmacist tomorrow or Friday morning. There's still flyers up here if you need anything from Delta or anything that's handed out. And then I know that PBA and HBS both pens and fun stuff from the bank.